Hello, everyone. My name is Alexis, and I done my research topic on teens pregnancy in today's society. In today's society, teen pregnancy is still as prevalent as in past years, which causes higher school dropout rate, low unemployment, and more health problems in adolescents. But with better education and resources for teens, I believe that there will be a decrease in pregnancies in years to come. To start, we're going to talk about the history of teen pregnancy. Before 1960, people were embarrassed if their child became pregnant. This was a moral issue for most families. They were sent to live in shelters for 9 months. The baby was born and they would be put up for adoption, and then the adolescent would come back to their parents' house as if nothing happened. After 1960, society was more worried about the poverty cycle trend that was happening when teenagers became pregnant. Poverty cycle is when generations and generations keep going through poverty and never getting out of it. Teen parents were twice as likely to suffer poverty. Outcomes of teen pregnancy include high school dropout rates, unemployment, health problems for the adolescent, and health problems for the baby. High school dropouts. 1.5 to 2.6 fewer years of education was received for teenage mothers. About 70% of girls who got pregnant will drop out of school. This hurts their chances of getting into college and finding a job that they enjoy. The big question is why these girls drop out. The big reason is because they do not get excused absences from the schools, and they miss a lot of school from going to doctor's appointments for the baby and themselves. This causes them to be behind in school and flunk the grade. Counselors often push them to do alternative school because they do miss so much of it. And then they get left out at school events like prom and homecoming because they're pregnant and can't attend. Title IX policy is supposed to protect pregnant girls from being left out or being discriminated against, but most schools ignore the policy. It has shown, though, that communities with more resources are able to help young mothers more by providing them more different programs to participate in and support. Unemployment. Since most do not have an education, they cannot find jobs. They do find a job, they will not enjoy it, which will cause them to be unhappy. They won't put as much effort into it and result in being fired. 80% of young mothers end up on welfare. You can see in the graph on the next slide that youth ages 16 to 24 years old have the highest unemployment rate since the 1960s. The blue line represents youth 16 to 24 years old, and you can see that it has always been the highest out of all the other age groups. Health problems for adolescents include anemia, high blood pressure, postpartum depression, and then these issues occur because mothers are not taking the right prenatal vitamins or going to childbirth parenting classes as the older mothers do. Health problems for babies include low birth rate, premature death, high rate of infant death, and then greater risk of pelvic disproportion, which means the baby's head is wider than the pelvic opening, which causes damage to the baby. Prevention strategies. Sex education. Sex should be talked about at home and at school. It is proven that open sex talk helps teens take more responsibility of their sexual behavior. I think that sex education should start as low as middle school and go all the way up through high school, all grade levels. More effective contraception. This helps adolescents practice safe sex. Resources that will benefit young mothers include parenting classes, support groups in the community and at school, teen pregnancy centers. Those have lots of resources for teenage mothers, and then communication lessons that help teens learn how to communicate with their partners and avoid peer pressure. There will always be teen pregnancy. However, it is showing a decrease in the United States. You'll see on the next page there's a graph that supports this fact. With the help of different resources, these teams might be able to prevent it from continuing. Education in schools and at home will combat the poverty cycle from continuing. Here is the graph that shows the pregnancy rate is declining. And then here are my resources. Thank you guys so much for listening to this. I really enjoyed learning more about this topic.